All right, well, welcome to today's awesome Survivor Circle. Very excited about this one and so happy to welcome my friends Angie Kahn, Jamie Rosalind, and Sarah Helms to kind of steward a candid discussion about mental health diagnoses, what all that means, and navigating all that if you're a survivor. So, welcome to the three of you, and I will turn it over to you.
Thanks,
Thanks,
Becky.
Becky. So it is Mental Health Awareness Month right now. And, when the three of us started talking about what we wanted to do to honor and to present something on theme for this month, the topic of diagnoses came up. Jamie and Angie and I talked quite a bit about different directions that we could maybe go with this conversation. As always, when we come together, we kind of want to take a lens of like, what's the stuff that not everybody's talking about? Like what's like a topic that we can kind of like get into and dig in a little and kind of get not just scratch the surface, but really get to some of the root of stuff that people really are like boots on the ground. What are we really dealing with? Not to just sit here and talk about like the DSM or and that stuff is good too, but to really kind of think through the lens of like how do these mental health labels and this diagnosis, like even the process of getting a diagnosis, like how does that really play out in the real world for real survivors in real settings? So that's kind of our goal for today. With that in mind, I would say anybody who's joining, if you have, personal experiences or things that you'd like to share or questions or comments, please feel free to chime in. We always like for this to be more of a back and forth conversation instead of just us like, lecturing. So please join in the comments. I guess as a starting point to even start off this idea of mental health diagnoses and these labels, the automatic question that comes up is like, well, why do we even need these labels? And different people have different reactions to being labeled. For some people, that can be really positive. For some people, they feel a lot of stigma or shame. Some people may experience just various forms of honestly re-victimization as a result of their labels or as a result of settings where they're being served. In reality, the biggest reason in America why we need these labels is just the practicality of getting your mental health services paid for, to be completely honest. Most people who are seeking services in outpatient settings are needing to use health insurance to pay or offset the cost of their appointments. And health insurance requires providers to have some diagnostic label before they will sort of justify their willingness of why they're willing to pay for you to come get that service. So just in terms of like a reality of that, that's kind of, as a psychologist, I am often confronted with that question of like, well, I have to give you some label. Now, maybe we can have discussion about what those labels mean. Sometimes there's more than one label that might be an appropriate fit. So in terms of kind of why that's where we, I think, have to open up the conversation is really in the structure of mental health care in America. But if we kind of get through that point of like, okay, so why do we even have it? Maybe then the question becomes, well, how does it impact us? And that I think goes in a lot of directions of pros and cons, ways that some people find the labels to be very helpful, ways that some people get harmed by it. So I think as a framework, that's maybe where I'll open it up. And then Angie and Jamie, if you guys have thoughts on that, we can join in there maybe.
Yeah.
Definitely when we're talking about like mental health diagnosis, there is this like point of where like what are the pros of like receiving a diagnosis and like what are the cons? And when you're in the setting where you're billing, insurance or like Medicaid or Medicare, then you have to have that diagnosis. This is kind of like slightly off topic, but my mom was going through a physical health crisis and wasn't able to get diagnosed, and therefore we couldn't get anything covered by insurance. Like it was such a nightmare. And just me taking that in now, thinking about how that can impact people like in mental health, like if they don't have the correct diagnosis and they can't get the correct treatment. And so that being like a definite pro, at least in the framework of, the country and the healthcare system that we live in, that you have to have a diagnosis to be able to receive treatment and for things to be paid for. But thinking through like other, pros and cons of, having a diagnosis or having a label, and you know, some of the pros being like, it can be a helpful framework to understand like what you're experiencing. Um, you know, for example, with like uh, PTSD and like hypervigilance and dissociating, all of those things can be really scary to like go through and experience when you have no idea that that's what's happening, and um, that you're not just a quote unquote like bad person because you have difficulty regulating your emotions, and are constantly feeling unsafe. And so definitely like those pros of having like that framework for like healing, of understanding, oh, I'm experiencing these things as like a result of trauma, and therefore I can like build coping mechanisms and like seek out treatment to address those things instead of just feeling like I'm losing my mind and unable to operate in the world as other people do. So that definitely being like a big pro, but then also having like cons, and you know, there being like stigma, and I'll keep it at, you know, PTSD as this example. You know, PTSD is so associated with, you know, people returning from wartime. Um, and so having like that diagnosis or talking about that diagnosis gets so like correlated um, to veterans, and a certain way that PTSD has been like shared in the media and like through movies. And so people anticipate it looking one way, but for survivors of abuse and child sexual abuse and all these other types of abuses, it might look a whole lot different. Um, so just even people's like preconceived notions of like what it means to have a certain type of diagnosis, and like the associations they form with those diagnoses can like be a con. I don't want to um, take up all the space on this call. So Angie, do you want to add maybe of those pros and cons?
No, I was just getting lost in what you're saying. I was leaning in and listening. But it's yeah, all of that. You know, as I was thinking, there's so many layers to this. I think, you know, a pro for me personally, as a survivor of childhood sexual abuse, it was to know, like, to understand myself more. I really wanted to understand, why do I do these quirky things that other people don't do? Like, why do I have to I'm so sorry. Why do I have to wash my hands so much? Or why do I have to you know, whatever it might be from the trauma. And so it was a really isolating place to feel like, well, I'm the only person going through this, right? And so, you know, and in a professional sense, working as I work with survivors of childhood trauma, you know, I just see some of the same things. Like, they're able to understand themselves better. They're able to then finally feel like, aha, like that does make sense in the context, right? Because we can take it out of context, especially when we're dealing with mental health diagnoses. You know, we have like social media now, where a lot of people are self-diagnosing, and you're seeing all these things on, you know, on social media, which could be, you know, good and not so great, right? Because I don't recommend like just self-diagnosis alone. And Jamie, you touched on it earlier. I don't think it was off topic at all. People that have physical issues, and we all know, as a result of childhood abuse, we can have physical issues, or even later in life, developing physical issues, and which can lead to mental health things that we need to get taken care of, depression, anxiety, those things that kind of are comorbid with that. And so I think, you know, Sarah, you touched on it earlier. Some of the cons is it can be used against you. I've also, you know, been on that side of it, where I've seen it used against people, and I've been a receiver of it being used against my diagnoses, being used against me and weaponized. And so this is like this space when somebody is on the precipice and just beginning this journey of maybe wanting to get you know, wanting to get help, wanting to get some answers for what they're experiencing. it can be scary. It can be scary because we have, you know, as you know, survivors of abuse, we have trust issues. There's lots of fear. There's lots of, you know, hesitancy. You know, people, you know, so I've heard people say, you know, I've lived with it for 30 years. I might as well just, you know, push through it. Kind of the cultural approach of just put your head down and just move through it, which is so isolating and so lonely to go through. So
I want to come back to that, but you guys both kind of touched on this idea of like physical health versus mental health. And so as a mental health provider, I just want to like pause there because this is a soapbox that I will like get on every time. Y'all, mental health is health, like period, the end.
yeah.
There is no like physical health, mental health. Oh, I got to have these two different buckets. Mental health is health, full stop. So when we as a culture start to put these into these different baskets, like, oh, well, like, you know, physical health is over here and mental health is over there, we start to create some of this stigma, right? We start to create some of these barriers because if you go to the doctor, if you go to your primary care doctor or a specialty doctor and you get diagnosed with diabetes or high blood pressure or any list of physical health conditions, we really don't see this pushback. There's people aren't saying like, oh my gosh, like I just don't want that label. Like I know that my insulin doesn't react appropriately. I know that I'm going to have to do these injections. I know I need to count the carbs, but like I just don't want to call it diabetes. It just doesn't translate. And so when we have this dichotomy and this false dichotomy of like, well, mental health is this different thing, I think it fuels some of this. Like it's so common that people come to me and when we're talking through collaborating around this diagnostic process or what the treatment process might look like, it's like, well, I just don't want that label. And so really that's an opportunity for conversation about like how is it that this feels different compared to other labels, physical healthcare labels?
Yeah, I think that, thank you so much for saying that first, because you know, you know, when we step back and look at it, well, of course, like we are a physical being, we are an emotional, like we have our mental health, like we're all interconnected in being human, right? And so of course we're going to have a couple of different layers to us, and so, but I feel like the way that society has kind of chopped it up, right, has allowed room for stigma and then further stigmatized different populations of people as well in this, and so that gets into the complex layers that start to pile on top of each other, and then, you know, mental health for our mental health providers, right? Like, so you've got all those layers kind of all swirling around in this space, which can be hard.
Yeah, it's making me think too about like different physical health diagnoses like polycystic ovarian syndrome or like PMDD, which I don't know what that acronym is, you know, spelled out, and how those physical health diagnoses can have such a big impact on your like mental health. And like some of the symptoms are like low energy, low mood, like all of these other things. Um, and so really thinking about how like physical and mental health, like, you know, um, interact with one another and are so connected.
Yeah.
Even though we live in a healthcare system and a society, which are like, these are different. These are two different things. So I think that is a excellent um, point,
Yeah.
Sarah. I also want to talk a little bit about like the idea of like a con of like some diagnoses. And that's almost like the over identifying like with a label. And it's just almost like taking a diagnosis like anxiety or like depression or like anything else and just saying, well, that I am that, like I'm gonna wear that and I'm gonna put it on and it's almost like, well, it's gonna shield me from actually having to do anything to address it or to work on it. Or it's just almost like, well, I have this thing so that can just explain away this like, you know, behavior or like way of being. And it's almost like a self-destructive it can become self-destructive. So as opposed to like being diagnosed and that being like a positive thing and like helping you feel relief and connected with others and like, oh, there's frameworks for me to address this, it can almost be like you put on a diagnosis and you put on like a hopelessness with like the diagnosis as well. It's like, oh, what's the point? Like I have this thing. Um, and just knowing some of my own struggles of like working through mental health stuff and like, yeah, there are like points of like hopelessness, but also knowing that there always can be a path forward. And progress in healing isn't like linear. And so sometimes it's not like this, like, oh, I'm like, I started here and then like, oh, I'm at the top of the screen now. But it really is just this like day to day and like looking at like, well, what is my best for today? Like, and what does hope look like for today? So definitely seeing this kind of, I think Angie, you talked about it like self-diagnosing a little bit, but then also like over-identifying in a way that doesn't help you process through and like work through like a diagnosis.
Yeah, and I think, one point of thought like I had as you were talking, Jamie, is like a lot of people might over-identify because they've just looked for a place to belong, right?
Yeah.
Like we all just want to belong somewhere. And then when you felt like you went through the trauma of abuse and you have felt so isolated and so different, it can be a place that people run into and kind of go way over here with it, and that can be harmful for them. I think one of the other pieces of stigma that I was thinking about as you all were talking was there can be like religious stigma around this. There are some spiritual beliefs that believe that you know you shouldn't go and get help for this. That you can, and I'm not going to take like I'm not trying to make that like an issue. I just kind of wanted to bring a little bit of awareness to that can be another place that people can get kind of trapped behind of that whatever belief that you are like, that might be one of the things that kind of has held you back from being able to get help.
Yeah, it's interesting, Jamie, when you're talking about this, like taking on an identity, like I am this thing more so than like I have this thing that I'm dealing with. I think some of that too can be very diagnosis dependent. So there are certain diagnoses that we think of as being sort of temporary or transient. So maybe, sometimes my anxiety is higher than others, or I might go through a period of depression and then come out of that depression and not be depressed anymore. Just because you have depression for weeks or months doesn't mean you're going to have it every day for your entire life, right? There are other diagnoses where we think of like autism, for example, where we think of this as being maybe a little bit more towards the spectrum of like, this is more of an identity. This is more of who I am, rather than something that's going to kind of wax and wane symptomatically, which of course it does. But I think when we start thinking about how different labels fit different people and how different people identify more or less, I just want to kind of bring that point to light also, that different diagnoses by definition are intended to be, in some cases, more permanent and some more transient.
Yeah.
I think there's also a lot of community for some people in that. Someone who may have gotten a diagnosis later in life, for example, ADHD or autism or something where maybe it should have been picked up as a child, but for whatever reason it wasn't. And they've gone through a lot of years of not having that community or not understanding, why am I not fitting in, or why am I different than my peers? And so then to come under this umbrella of saying, okay, there's this whole community of people out here who are neurodiverse just like me, and it's not a problem. There's actually strengths and assets and positive features of this that can be very fulfilling for some people to kind of get to that point.
Yeah, you're speaking my language now, Sarah. That's been my experience. I was a later in life. I was 47 when I was finally diagnosed with ADHD. And there was a grieving period to that, because I thought about like all those things that were used against me in childhood by my abusers. And they were part of my, I call it neurospicy, but neurodiverse, just who I was, like part of me. And then I had this grieving of if somebody would have caught it, like then because I have the impulsive type, so those impulses to do those things that were like edgy and that were like harmful in sometimes, could have possibly been avoided, and of course, allowing that period of grief and being able to move through that grief, because I think there is for those that have experienced childhood abuse, there's a grief to that, and then for those that have experienced childhood abuse and then are dealing with the aftermath of that, or are learning, because some of the diagnoses are actually related to trauma, right? And then some of my diagnoses were related to trauma, and some of them were just like genetic and just in me, right? And I think that there's so many layers of grieving to that as well, and finding space to grieve, because we live in a society that says, well, you should be over that happened 30 years ago, like why aren't you good now? And so there's so much room within this space to explore those things too, if we have the right support as well.
It's making me think too of like the DSM, and that's definitely not like my specialty, but just also just thinking about like healthcare and how like deficit based it can be. Like it's always looking for like problems or a lack of something. And so you have this like manual that, all the diagnoses are based off, and it's so deficit based. And Sarah, I know that you come from this like strengths based lens, but it's just like, and I know I've like worked with people like as well, where it's like, yeah, there are things because of diagnoses that like make life challenging. But then also there's so many strengths, like, and like, how do we like balance that of like, there's things that we definitely need to like work through, but like, how do I like own the strengths you know, of like quote unquote diagnoses or like deficits? Like it also means that like maybe I learn differently. Like maybe I can actually excel in areas where like other people don't excel in the same way. Um, so just, interesting. Like what would a DSM look like that wasn't just looking for like deficits, but was also looking for like, um, looking for like, does this person have like great like lateral thinking? Um, like, does this person like, are they really observant? Like, and it's kind of seeing things in a more positive light. Obviously, we're not going to change the DSM with the Survivor Circle, but it's just making me like curious. Is it definitely comes from this like deficit framework, but what would happen if we applied a strength-based framework? And I'm sure you do that on a micro level in your work every day, Sarah.
Try to, thank you.
Yeah.
Yeah, I mean, I think the DSM obviously is created in this medicalization type of a model, right? Where we have a list of symptoms and you have to have a certain number of symptoms and a certain number of categories for a certain number of days, or, there's sort of all these regulations in order to say, or rule in or rule out certain disorders. And so that does start to look a lot like a medical model in terms of diagnosing. I think that sometimes there can be a shift from what does the diagnostic process look like to then, okay, but what does the treatment process look like? And so, unfortunately, when I'm providing services under an insurance or outside payer mentality, I am required to have a diagnosis, right? I can't just treat you because I think that it would be helpful. Like I think therapy would be helpful for everyone in the world, but I'm not, I'm not able to do that. But then hopefully what I strive to do is that we sort of take that label, collaborate around that label, talk through it, and then transition to a space of, okay, like now that's just a word. Like we can call this gobbledygook. Like it doesn't really matter. Really, this is a word that captures a list of symptoms and enables you to have access to care. Now, I don't really care what that label is. I want to get underneath like what's driving these behaviors. What's the root cause of this emotional reaction? What, like, I know you've got these symptoms, but the label is just a word that goes on a form in a file. And now we start to really go back to the source, go back to each of those symptoms and figure out, okay, if this emotional piece or this behavioral piece or whatever, what are we going to do with that?
Mhm. Yeah, and I think so much we can get so hyper focused on like what's wrong with you that we don't, Jimmy, like you're we don't look at like what's right with you. Like what are your strengths? I was able to like just really like observe someone working with a patient, and a patient with oppositional defiance, right? And when that person said to them, like, wow, you are such a great advocate, you just come in here and you just see all angles, it was almost like this young woman's face just like lit up in a way like that shocked her, like because everybody had always told her like you're too argumentative, like you don't listen, like you don't do what you're told, all of these things. And when somebody started to really take that and kind of flip it upside down, she then began to see her strengths, and part of like her mental health and those things that had really been viewed as a negative, how she could use those to her benefit, right?
Absolutely.
It makes me think too, like everyone could like benefit from therapy too. And just thinking about like the state of the world that we live in, and just especially since, 2020 and like COVID and just, just all of these things like going on in the world, like how much of these like symptoms are just a normal reaction to like existing currently. Um, and that point where like, are is there more awareness of mental health because people are like talking about it now, or is there really more, are people really experiencing more symptoms, or is this really just a normal reaction? And is therapy just beneficial because existing in today's world is challenging all on its own, like without trauma, without abuse, without all of those things, just existing can be challenging in the current state of things.
Yeah. And it could be a short term that somebody needs just a little bit of encouragement and professional help. It could be an ongoing thing as well. And also like recognizing too the challenges and the stigma for people in minority communities as well, to mental health issues. And gender, the gender based like biases and stigma that we have around it as well. And so I just wanted to take a moment like to recognize those things too, because we're growing up in a society that says, well, men don't need mental health issues, or there's not enough specialized care for transgender people for mental health, or gender fluid people. Like there's so many other like populations that really need the help and aren't able to access that. And so being able to, one of the things I love to be able to help plug them in, like here's this resource, I don't know if it can help, but maybe like, so like a lot of more education for professionals around those things too.
Well, and then even if there's like the awareness and you get past like the stigmatization of like, you know, um, whatever cultural barriers there are to like seeking out help. And then when someone goes to seek out help, and whether that's like a Black woman or like a man going to seek out help, and then they're finding, or like a transgender person, but then they're finding that they're not finding affirmative care, like,
Right.
or the conditions of them receiving care are in lockdown facilities, whether that's like a mental health facility or like a Department of Justice facility. Like the only exposure that they have to care are in these like corrective or lockdown like institutes. So even once you get past those like cultural things, like then but what's the quality of care,
Yeah.
for these individuals? And is it going to be affirmative care?
Mhm.
Yeah.
Yeah.
Yeah, and correctional settings are the number one provider of mental health care in America.
Mm.
So there's a huge portion of our society that is only accessing care through locked facilities.
Well, and
Yeah.
then what happens with the diagnosing with that, Sarah? I think when we were talking about this call earlier, like talking about these topics too, like the difference in how people are diagnosed based on their gender, based on their skin color, based on different things.
Yeah.
Yeah, and there's absolutely data out there around that. I'm not going to sit here and quote all the studies, but an African American male who presents with the exact same as middle class white male, just even just taking that, like when you break down the income and the race, even if we hold constant the gender, much more likely that low income African American male is going to be diagnosed with oppositional or conduct disorder, whereas that middle class or more affluent white peer is going to get ADHD. Just presenting in the same way, but again, some of those cultural lenses and biases that we know that exist.
Yeah.
And then you start to factor in the settings where those are being applied. It starts to sort of magnify some of those differences culturally.
Yeah. So how can someone in those situations, how can they advocate for themselves as they go and seek care? Right? How could it how can then we have to look at how can we be, our biggest advocate, and which is hard to do for people because depending on the situation, we can shrink back from feeling like we're deserving of care, from not wanting to come off too aggressive when we go and get care. Like there's so like again, kind of going deeper into the layers and the facets that surround mental health.
Well, and even just the power differential to even know, am I allowed to question this provider? We are sort of socialized to think like, the doctor knows best, whatever they say goes. And so do we even feel comfortable to open that dialogue with a provider to say that you disagree, or to ask if if you have questions, even not to necessarily disagree, but even to just ask, like, hey, help me understand, why are you diagnosing me with this? Where is this coming from? What does this mean?
Yeah. What have you all seen in people that you've worked with or noticed that has helped them to best advocate for themselves in those kind of situations?
I'm like kind of going back to like my mom and her like physical health like crisis, but it was just kind of the same thing where like we were dealing with doctors and there is that like power differential. Like the doctor is like the expert and the specialist on like these things. And like, my mom like being undiagnosed, and it just really took a lot of, we were getting to the point where we were just being told, well, there's nothing we can do. It's just like, well, you have to do something. And so I think that advocacy around that physical health issue was really born out of like desperation. Um, and so taking that like to mental health, if I'm like seeking out treatment or like seeking out a diagnosis or like nothing I'm finding is like working for me, it's almost like you have to tap into that like desperation of like, I deserve to be
Mhm.
treated. Like I deserve to like exist. Like it's not over for me. This can't like be the answer. And I think at least in that physical healthcare setting, which is the same as like mental, it came to like, I know you're the expert, but there is something very wrong and there has to be more that we can do. And so, and part of that process was seeking out second opinions, like seeing different
Mm.
people. Um, moving beyond what was initially offered and like figuring out um, other pathways to treatment, which ended up working out. Like my mom got diagnosed and things ended up having a positive outcome with that. But it took a lot of advocacy, and it was a physical health setting, but it's very similar to like mental
Yeah.
health.
Yeah. I love that you said not being afraid to get that second opinion. Um, on things, because sometimes we need to not accept, when we know, like, you know yourself best, right? Like, they may have, like, the professionals have expertise and training and what they specialize in, but you have expertise in yourself, and what you've been experiencing day in and day out. And not being or taking somebody with you.
Yeah.
If you're feeling like, well, I want to approach this again, I've said it twice, and I'm just not okay with it. It's not what I'm the advice that I'm giving, or the medical input that I'm getting is not working, and I'm afraid to ask again because they're not listening. It's okay to take someone with you that you trust, right? That can, my oldest is going through lots of different issues, and she's like, you got to come with me next time. Yeah, and I know that in that situation, like, I'm mom, but like, I do, like, my friends, I would do that, and other, like, clients, like, I've been known to, like, jump on a call with someone and just say, this is how I understand it, this is how I see them, this is some of the struggles that I've witnessed. So having that backup.
Yeah. I think a huge piece of advocacy, to make it feel more manageable, especially if you're someone who's kind of coming into a situation feeling uncertain or feeling maybe a lack of confidence in your ability to advocate, it's really shifting that lens from, I'm not trying to argue or fight or push back. I'm trying to get in a space of curiosity. And I think when we shift from that, like going on the offensive and trying to argue or prove a point, and really get to that space of like, I'm just asking questions, right? I'm trying to understand. So I think when we lead with like, if as a provider, if someone comes and asks me, help me understand why this and this, or hey, I was doing some reading about this and I'm wondering about A, B, and C. For me, I'm like, yeah, let's talk about it. Like, this is awesome. This is a chance for us to collaborate. You're coming in here asking great questions. I can tell that you're obviously invested in your care. You want us to be in a dialogue about this, right? That opens doors where we can kind of have that conversation. And I think on the flip side of it, like if I'm the patient, I feel more comfortable with that lens of I'm just trying to be curious and understand, where for me to kind of come in guns blazing feels a little bit uncomfortable for me. Like I'm kind of coming at this provider, which is not, I think it's just not my style.
Yeah. Yeah. Being able to, maybe take a step back and okay, that approach isn't working. Like, okay, well, maybe, like, help me understand, because I do want to understand. I am curious about this, right?
And frankly, if you, as a client or as a patient, if you're asking your provider questions and they're not willing to engage in that conversation, that's a huge red flag, right? Like if you're saying, hey, I'm curious about this, can you tell me about this? And your provider is unwilling or unable to answer those questions, that might be an indicator that you need to find a different provider who is interested and able in collaborating, because this should not be a power dynamic or a hierarchical thing where it's like, I'm telling you the right answer and you better fall into line. Again, that's a red flag. This should be collaborative. And it might be that I am more of an expert on the DSM, but Angie, to your point, I always lead in conversation with saying, you are the expert on you, right? You know what's going on inside of you. And unlike physical healthcare doctors, like I don't have a thermometer to stick in and see what your emotions are. I don't have a blood pressure cuff to like look at that number and go, oh, you're like a 120/60. Like that means blah, blah, blah. Like I am going to rely on you to talk to me about it. And so I naturally need to trust what you're saying about yourself, because that's really all I have.
Yeah. I heard someone say one time, like, don't be afraid to interview. Like, if you're looking for a therapist, don't be afraid to interview a couple and see. I think sometimes we plug into things and we think, well, this is, I'm going to just go to this person, and they might be great. Like they might be the person for you. And that's great. But in some cases they're not. So don't be afraid to like interview them and ask them specific questions on, topics and things. Because that can feel
Obviously
intimidating, right?
there's different approaches. There's different philosophies, there's different personalities, right? Like it might just be that like you and this person just aren't a good fit. Like we're not just naturally as humans wired to be best friends with everyone we meet on the planet. Like that's crazy. We would never think, oh, I'm going to be
We're
best friends with
not.
everyone in the world.
Oh
But yet
no.
it's like with a provider, it's like maybe we just don't click. Like that's fine. You know, I know I'm not going to be the perfect fit for everyone. That would be outlandish to think that.
Yeah.
I was just thinking too, like with the DSM and like diagnosing and like the idea about being curious in this like gray zone, like in diagnosing, like where some of like the symptoms in the DSM really like overlap with like other, like one diagnosis can look a lot like another diagnosis. And so just thinking about like those gray areas and like being curious and having that collaborative spirit, it's like, well, why is it this over this? These are really similar. Um, yeah. And kind of back to your point, like Sarah, when there's people who take that approach with like diagnosing, but then like once you have that label that you need to bill insurance or like whatever it is, then it's much less about like what that label is and more about that person's lived experience of that label. What is their lived reality with this? And it kind of becomes less important, I think, of like exactly what that label is, but like how do we address that that reality that that person is experiencing.
Absolutely. Yeah, when you're talking about the gray zone, I mean, I think the biggest issue and the biggest struggle I personally have with the DSM is the gray zone, because all of these things we're talking about occur on a continuum, right? Like there's not this just artificial line in the sand that's like, okay, boom, you have depression, you do not have depression. It's really it's like there are people with a little bit of symptoms, a medium a bit of symptoms, like this so at some point it's like, well, you have a little bit of this, but maybe not all the way to where this line is in the sand, right? Like those people probably still need help with the few things that they have going on, even though they didn't like hit that exact mark of symptoms, right? And a lot of times for me, the gray zone comes in that space of like, well, it doesn't just look like one clean, cookie cutter little answer. There's a little bit of this and a little bit of that, and not quite enough of that, but that's still in the mix. Like that's still something we're going to address, right?
Yeah, that's why they call it a spectrum, right? Because I know specifically they call autism spectrum, right? But with so many other things, there's just it's not just this or this, right? And so yeah, sometimes knowing that like can bring that relief, right? Like to know like, oh, okay, like this is normal, this is okay.
Yeah. And certainly, in thinking about your own symptoms, putting that back onto the continuum instead of just that categorical, like, so do I have this? Yes or no? Well, how much of this do I, on a scale from 0 to 10, how much of this thing am I dealing with? How much of that thing am I dealing with? Right.
And it can vary from day to day too.
Yeah, absolutely.
Which
Sometimes
further
minute to
complicates
minute.
things. Yeah. Well, I feel like there is so many layers. And I think we had talked about, we're gonna like put a tip sheet out there on how to best advocate for yourself. We have our glossary of terms for people to like better break it down and understand. And then I know, Sarah, you were gonna do some videos on some things to help at some point to just help people, just understand a little bit better, do their research, right? It's okay to do your research. And sometimes like taking a push back from the table and just breathing and take that pause.
Yeah.
Just even
Sorry,
from
I was just going to say, like, I think that point about doing your own research is actually a really important point about all of this. Like Jamie, you were talking about the DSM, right? Like there is this book. It is called the DSM, the Diagnostic and Statistical Manual. It is sort of like the Bible of diagnoses that the American Psychiatric Association kind of has these guidelines that are published, but anyone can get that book. You can go to the library, you can go online and Google it. Anyone, you don't have to be a prescribing doctor or a mental health care provider to access that book. So really going and doing some research, reading about some of the symptoms that you're having, reading about some of the labels that maybe you've had in the past, trying to understand, does that still fit or not? All of that is something that you absolutely can and should do, on your own, in addition to those conversations with your provider.
Yeah. And as far as like advocating for yourself, I have just been jotting down a few notes so we can like recap, so far we have like take someone with you that you trust. Know that you're the expert on yourself and you deserve quality care. Shift from coming from like a stance of like being argumentative to being curious, and asking questions. Try to be okay with shifting to another provider who is the right fit. So if you're seeing someone, know that it's okay to, if it's not the right fit, to move on. And then we have, interview therapist. And I put in there too, like word of mouth, especially for like marginalized communities. Like you want to make sure you can find providers who are going to be affirmative. So like do your research on that, like find different networks. There are definitely like whatever you have going on, like there's a provider for you, like, and who can work with you, like with that. And so word of mouth and do research. And then yeah, research the diagnoses themselves. And then also just like another resource for people is currently on the website and that's available, right now is Sarah's like coping toolkit videos as well. Her like mental health. So that's on the Survivor space website. I don't know if Becky can maybe try to source that and pop it in the chat for us. That would be great. But that's where our like advocate for yourself toolkit or whatever, like that's what we're building today is, you know, on those things. And I love all like each of those points so much, like knowing you're the expert on yourself and your experience.
Because I really do feel like even hearing you say it, Jamie, it was like, oh, you kind of sit up a little bit taller. Like it flips it on its head of being told that you're hard to work with or you're hard to, talk to or like, yeah, it feels like it shifts, the language shifts it into being more of a positive or more of an affirmative space too.
Well, and that's like definitely one of those red flags too. If someone's saying you're hard to work with, you're hard to like deal with, then like that doesn't sound like the right provider for you. If their ability to treat you doesn't like speak to your worth and your value, like
Yeah. And it may be like they don't have the right tools, they haven't have the right training and I mean, that's just all part of the bigger picture too.
Yeah, I think that's actually a really good point about the training. And when you're thinking about shopping around and finding the right provider for you, here again, the distinction between mental versus physical healthcare, you would never go to just one doctor and assume that they can treat every condition that every human has. I mean, we have specialists for reasons, right? And so some people really specialize in one thing or another. Sometimes you might start with more of a general provider and then get referred to a higher level of care with a different specialist. For some reason in mental health care, we have this idea that like every provider is going to be able to work with everyone that comes in the door. And really, it shouldn't be that way. It really should be that you're finding someone who does, if you're going in talking about trauma, you should have someone who has especially training in trauma, someone who has worked with folks who have experienced similar things as you, and that they have not just that their personality is the right fit or that it feels like a good vibe, but that they have a skill set that aligns with what you need. So I think that's another piece too for this advocacy is kind of figuring out what it is that you're looking to work on. And if you have many areas, that might involve being in different spaces at different times. Maybe we're focusing on this topic with this provider, and then, years down the road, you're focusing on a different area with a different type of therapy, a different type of provider.
Mm-hmm. Yeah, that's a great point too of knowing sometimes you outgrow providers, right? It might have been a good fit for that time and you've outgrown that and you need to move into, a different space as well.
or just even different focus areas. I mean, I think people who have experienced childhood trauma and like different abuses like across the span of their lifetimes are going to have different things they want to focus on at different times. And then also life keeps going on. And so outside of like trauma and like abuse, there's other things that happen in life, like, a parent, having a health crisis or, so many other different things that happen in the course of just regular life that could be the focus areas. And so you might not want to see like a trauma focused specialist if you're, you know, um, experiencing whatever, mental health crisis, from this other thing that happened in life that's not related to trauma. Or maybe you do. I'm not sure, right? But that's like the whole thing. It's like for you to figure out like for yourself. Um,
Mm.
and I guess there aren't like traumatologist, I guess, like as like neurologist, like there's not traumatologist or like griefologist or, you know, um, all these different ologists, but there are people I think who do like their areas of expertise are like, even though we don't have those words or the language or to put that on what's the website like psychology.com where every therapist ever is. So they don't have those like specialties like right by their names. But if you read, if you read um into their bios, it kind of like reveals itself. Like, you know, some people focus on like family or like marriage. And so you probably don't want to go see the marriage counselor for your like childhood trauma. So
Yeah. Yeah.
Yeah. So I guess
Yeah.
as
And
we,
I think I think also like writing down some things that do work for you that you've noticed that do help you to regulate or help you in whatever area, writing down those things that do work for you and maybe even thinking outside the box in terms of support as well.
yeah, I love that. Actually, anytime someone comes to me and they have been in any type of therapy prior to making it to me, I always like to ask them, what has worked well and what has not worked well from those prior settings or prior providers that they've worked with that same idea, Angie, of like, let's figure out what it is that's working well for you. That's a great space to build from. And also let's figure out what are the things that were not particularly helpful so that we don't just continue doing the same things that you've already had exposure to and that weren't a good fit for you. And so that's always part of that conversation of how do we make this the right fit for what you're looking for? And am I the right person to provide whatever that thing might be?
Yeah.
So I guess as we are kind of wrapping up for today, we can kind of go around and maybe each share our own wrap ups or like kind of final parting thoughts. For me, our whole topic for today was about mental health diagnoses. And for me, I think at the end of the day, a diagnosis should be a tool. And just like any other tool, right? We can use that tool for good or for evil. We can use that tool in a way that is helpful, that gives you access to resources, that gives you a better understanding of yourself in ways that feel affirming, or that tool can be weaponized against you. So just being aware that whatever those labels are, they should be being used for positive. And if you feel that they're not, then that's a space for conversation. That's a space for working with your provider, opening up some of those getting curious moments and conversations with the provider, figuring out how to collaborate in a way that feels helpful and productive. And if you get to a space where you feel like you're not able to do that, then maybe that's the space where you start finding another provider who is able to kind of meet your needs and do it in a way that feels affirming. If you need a label to access the care that you need, then maybe that in and of itself might be the reason why. You just say, well, yeah, I don't love this label, but it's a means to an end. It's a tool that's going to allow me to get access to the care I need. Or maybe you're one of the lucky few who is able to find care in a setting that doesn't require it. If it's a label that you feel is an identity that you aren't in a space to embrace for whatever reason, maybe finding a setting where you can access different types of care that don't require it. But again, knowing the label is just a word. right? It should not be applied to you as an identity. It should not be put onto you as a label that says this is the be all and all. And if it is, then figuring out a way to navigate that process and advocate for yourself is really important.
I think something that we talked about today too, and the advocating for yourself is just knowing that like whatever you're going through, like whatever like the symptoms are, there's strengths in it. And so just knowing that you have strengths, you're the expert in your lived reality, and that I think the biggest thing I want people to take away is knowing that you deserve and are worthy of like quality care. And it like and my wish and hope for everybody is that the first provider they ever walked in and saw, like that was their experience. And then as they continued that journey, they got quality care all along the way. But knowing but I guess that's the biggest thing is like, if you feel like you're not getting that quality care, like you deserve it and it's out there. And there's different ways of going about finding it. So, yeah.
Yeah, I just want to leave people with like, I am so glad you came to this conversation. I'm so glad that you're here today. If you're with us live or if you're watching this, like this is a huge space to step into, and can feel overwhelming at times. It can feel empowering at other times. And so there isn't a one size fits all, that you are a unique individual with unique needs. That sometimes have common threads with people and sometimes may not. So, yeah, I would echo both of you. You are worthy of care. You are worthy of quality care. And so, if we can help in any way at Survivor Space, like the resources that we provide as well, like we're here to walk alongside you. Because that's the worst. I've been in that space where that's the worst feeling in the world, to feel like I'm all alone in this. So you're not alone on the journey. And so I'm just so glad you're here and you came.
Thank you all so much for such a great discussion, such wisdom and compassion in what you all have shared. So thank you so much.